Don't think that surgery is the end all be all, but also use experiences like this to help gauge whether or not this is something that could work for you. I want to preface this video by saying, one, this is so long awaited for me, and two, this is the first time I've actually put on makeup and put myself together since my surgery. So welcome to my post endometriosis surgery video. In this video, I'm going to be talking to you guys all about endometriosis, how I knew I had it, picking a doctor, what the actual surgery is like in my experience so far, just so that anyone who is struggling with similar symptoms or is thinking about having the surgery or had the surgery, we can talk about it and you can have a place for resources. I found that I was only able to really confidently want to do the surgery when I talked to people who had had it before. So for anyone in their life who doesn't have someone who has ever had a laparoscopic excision surgery for endometriosis, this video is for you. Currently, I am about exactly 2 weeks out from my surgery, and do not let this video fool you because I am put together, I have a sweater on, and I have makeup on. I'm still very much recovering, but I wanted to make this video while everything was still fresh and I was still experiencing it, so that way I could convey it accurately. The first thing that I want to talk about is, how did I know that I had endometriosis? What were my symptoms? This is what so many people are asking. I have a video talking about some of my symptoms that are way back in my YouTube video, so if you want to have like a really in-depth, more of like in the moment experience, go watch that video. A couple of my symptoms were excruciating 10 out of 10 level period pains, like abnormal. I'm out for days, I'm taking off work, I'm in bed for a week, sometimes 2 weeks. Excruciating. Extremely heavy periods, so I'm iron deficient, abnormal. As a result of things being off in my body, I had really bad brain fog, I had severe fatigue, which later we'll kind of go into that when I talk about the surgery, and I've always just had hormonal imbalances. So at like one point it looked like really bad chronic acne. There were a lot of hormonal imbalances. I just felt something was wrong. And also, knowing that you have endometriosis and some of the symptoms, endometriosis and things like PCOS, it's a set of symptoms. That is like how they diagnose externally. So no, you're not crazy. I also feel like a lot of women intuitively know something is off about their body. And if you have checked off so many different things, then you will have an inclination that something is blaringly obviously wrong and is not normal. So do not deny your intuition, because my intuition knew something was off. I knew that what I was experiencing was not normal. I did so many blood tests, I did ultrasounds, I did all these different things, and no one was giving me answers. And it wasn't until I self-researched and learned about PCOS and endometriosis, which they're very similar, but I would say PCOS doesn't have the as excruciating period pains. I feel like that's the most differentiating thing between both of them. They're very similar in the way that they express themselves and the symptoms that you get. But I knew immediately when I looked and I heard about the symptoms of endometriosis, I knew intuitively that I had it. I just had to have someone else to validate my experience. Finding out that I had endometriosis, there is nothing that can actually confirm officially that you have endometriosis until you have the surgery and they remove the tissue and test it. And that's when it's like positive or negative for endometriosis. So anyone who's saying, how did you know? Intuitively, I know. My symptoms, it made no sense to be anything else. And then also, which I'll go into next, is finding a doctor who would believe me. I went to my primary care doctor. He told me I was fine. I went to my gynecologist. She told me I was fine. So you will be gaslit probably along the way on your journey, and you will probably be told that you are fine. But it is now your responsibility to keep investigating if your life is being disrupted by something that's going on internally, because a lot of doctors just aren't necessarily trained to investigate the way that we investigate our own selves, especially if the doctor is not specialized in endometriosis or PCOS or any of these gynecological, which I actually think it's a full body condition. You might not be validated, so you really have to do your own research. And so I did my research, and finding a doctor, I wanted to find someone who was the best. I live in Los Angeles, California, so I was like, who is the best, the highest, the top, because I obviously want to be treated by the best. I was really hopeful to get in with Hiii's Aliyabadi. I think she works out of Beverly Hills, but she is the one who did Olivia Culpo's surgery, and she does a lot of celebrities' gynecological work. And so I was very familiar with her work. When I called her office, I don't think that they even took insurance, and I think that they quoted me like $35,000 just off the bat, which isn't actually crazy compared to what I ended up paying paying, but we're going to talk about that in a second. So $35,000 out of pocket because I'm pretty sure they don't take insurance, or they didn't take my insurance. Whatever the situation was, it was just like, it's a no-go. The next doctor that I found that was a specialist and treated a lot of patients with this condition. Her name is Iris Orbach, and she also is in Beverly Hills. I called their office, and they do take insurance, but they are considered out of network for a majority of insurances. So how much you pay is dependent on your insurance. And Iris is someone who had the vast experience and that I thought was going to be the best person to do my surgery based on the extreme symptoms that I had. A lot of doctors, I even saw another doctor that I went to who was a specialist in the laparoscopic surgery, so it was between the two doctors, and she couldn't necessarily work on endo outside of the pelvis area, and sometimes endometriosis is outside. So it's like you want to have a doctor who maybe has another surgeon in the room with them that like can go in and get something if it's outside of the pelvis area. And so that's what made my answer even more clear. And also, as soon as I walked into the office, she validated me. She's like, yeah, you probably had it. She did a pelvic exam and literally felt my uterus, and my uterus was pushed to the left side of my body. She told me that immediately without, having to do too much, and was like, yeah, you more than likely have endometriosis pushing on your uterus, and your uterus is displaced. She told me that the first appointment that I went to her. No other doctor had ever told me that. No other doctor had even asked to do an exam. And that's how I knew I wanted my doctor. Now, I'm not gonna say that it's perfect and it's been a perfect experience. My doctor is very, very expensive, and transparently, I paid almost $40,000 out of pocket for this experience. And there's definitely a giant paywall between me and my doctor. My first appointment with her was $1,600, but I was so desperate, especially if you've been on this journey for so long, you will feel desperate. You will feel desperate to be heard and seen. And I didn't want to be told that birth control was my only option. I didn't want to be told that I would never live a normal life. I didn't want to be told these things that every single doctor had told me. And the only doctor who has ever talked to me like a normal human and has encouraged me to change a lot of my lifestyle things was Iris. And so she helped me look into my gut health. She recommended, doing pelvic floor therapy, all these different things. And she was like, birth control does not have to be the only option to manage your symptoms. That is what I need out of a doctor. I do not want to be told birth control is your only option. This hormonal replacement therapy is your only option. I really value doctors who look outside of just the classical Western medicine, and that's why I chose my doctor. Choosing a doctor is completely up to you. You have to go based on what you feel comfortable with, obviously your price range, but you really want to find someone who is a specialist in this surgery. Like I probably wouldn't have gone to just like a general laparoscopic doctor. I would have found someone who like specializes in endometriosis, just so they know what to see. They've heard all the stories. They are very delicate. It's obviously a very delicate, sensitive area. So just on your journey, just be gentle with yourself and like find a doctor who really hears you, believes you, because having to convince people that your excruciating period pain is excruciating is hard. Like people do not believe you when you say period pains are painful. Like, and I don't know if there's like a disconnect because people don't feel it themselves. But when I tell people I would have excruciating period pains, I'm like, oh my gosh, I'm so sorry. Excruciating means you're being tortured. Like the experience that I had was as if I was being tortured every single month, or I was having a child every single month. Now I'm like, oh, childbirth is going to be easy for me because I have felt the most painful thing I've ever experienced pretty much every month of my life. You really want to find a doctor who like hears that and doesn't just go over their head and like, okay, this is normal. You want to find someone who's like, this is abnormal, because it is not normal. Whenever you do find a doctor or surgeon, there's going to be a lot of pre-testing you're going to have to do. You'll probably have to do an ultrasound, a vaginal ultrasound like I did. You'll probably have to do blood testing, all of these different things. These are just to confirm and make sure that your health is well-rounded, and then also make sure that you have enough of an indication of something being abnormal. And if you have fibroids or cysts or anything like that, when they do the ultrasound, they will also be able to remove those in the surgery. Luckily at the time, I didn't have any fibroids and I didn't have any cysts on my ovaries, and that was great. So I went forward with the surgery. Now let's actually get into my surgery specifically. I'm gonna tell you what the pre-op was, I'll tell you what the surgery was like, and I will tell you what the post-op is like for anyone who is thinking of getting the actual surgery or has it coming up. I will tell you exactly how to prep and what I did. My doctor specifically ordered a bowel prep. So 2 weeks before surgery, I had to stop all supplements and, anything bad. So drinking, supplements, or anything that could be messing with your body or throwing your body off. And so 2 weeks before that, I stopped it. I'd stopped everything. And then a day before, for me, after 9 a.m., like 9, 10 a.m., I couldn't eat any solid food. I could drink bone broths or juices or different things because I was doing a bowel prep. Because basically, when you have endometriosis, sometimes the endometriosis can be in your bowels. So most doctors will order a bowel prep, which basically means emptying your digestive system so that if they need to do surgery in the bowel area, there's no problem. It's a little gnarly because you do have to take a laxative, and you obviously can't eat, and I had to do an enema myself, and this is the first time I've ever had to do an enema. I don't think everybody has this experience, but my doctor was very thorough and wanted to make sure that we were ready to take on whatever was in my body. I stopped eating around 10 a.m. I did the bowel prep, and then you can't eat until after your surgery. For me, my surgery was at 10 a.m. So the next morning I showed up. This is what I recommend. If you are getting the surgery, please have someone with you. I know that there are a lot of women who do not live by their families, who do not live by, a lot of their support system. I really recommend bringing a buddy and having someone that can be with you for up to a week or even a week and a half, 2 weeks around you to support you. And I say this because, one, post-surgery, you will not be able to drive. You will more than likely not be able to do a lot by yourself without feeling large amounts of pain. Coming out of surgery, it's a big deal. But I say this because even after my surgery, I thought that I would, 3 days, I'd be good. No, I needed someone there to help me sit up, help me lay down. I was in a lot of pain. And my experience might be very different from someone else's experience. It all depends on the endometriosis. It all depends on how much they took out. But if you are having the surgery, please find someone that can stay with you for at least 3 days and be really hands-on. Go stay with your mom, go stay with your, if you need to go by your parents, go do this, because you really are going to want someone there to wait on you hand and foot. So then I get to the hospital, I fill out all the paperwork, and you have to take a multitude of drugs. I had to take so many and get an IV, all of that. And then you talk to your surgeon, whoever they are, and you go into surgery. I will say one of the best things about my surgery, which I had it at Providence St. John's in Santa Monica, my experience at that actual hospital with the nurses on staff was amazing. I had the most amazing nurse staff. They were kind, they were loving, hoping that whoever, even if you can't have someone with you initially and you go there by yourself and you're getting picked up after, you should be fine going into the surgery because the wait staff or the nurses should really support you through this experience. And that was my experience, and hopefully it could be yours too. But you are definitely gonna want someone there to wait on you hand and foot for at least 3 days after. The length of the surgery is going to depend on how much endometriosis you had. Mine was only 2 hours. I ended up not having a ton of endometriosis, but it was very concentrated where she said it was, pushing on my uterus. So on the right side of my body, pushing my uterus to the left side. So she removed all that endometriosis there. They also ended up removing my appendix. This part I'm not happy about. However, I have to trust that the doctor made the best decision. They removed my appendix because it appeared really abnormal to them. When I got the biopsy and I got the labs about my appendix, it was actually perfectly normal. So I'm upset, but I also have to trust and believe that the doctors did the best thing that they could do. So if they ask you about your appendix, obviously you do not want an organ removed from your body, but you also have to trust that if it's covered in endometriosis or it looks abnormal, maybe they'll remove it. I don't know, this was just my experience, but they also removed my appendix, and so that was obviously extra pain. Leaving the hospital, you will leave the hospital same day. You're gonna wake up from your surgery. Usually it takes like an hour or two for the anesthesia to wear off to make sure that you're good to go, and they will send you off on your way. What I recommend coming to the hospital with is very loose clothing. I came in a dress and then I left in my Skims pajamas. The car ride home was pretty painful because during the surgery, they fill you with CO2 gas. The gas is what is so painful, and your belly is going to be huge. I will insert some photos. So leaving the hospital, my belly was huge. I was in a lot of pain, and that gas, you can feel it moving around. One thing that I found so surprising was the shoulder pain that you will experience from this surgery. Because of that CO2 gas, you will get really, really bad shoulder pain. And so it is abnormal. Like, it feels not good. Like, I was having, my buddy squeeze my shoulders, and I was using a heating pad, but I'm going to tell you all of the things to help manage this pain. You are going to want to have this list of things, so write it down. You are going to want to have very loose clothing. I have been literally living in dresses. I'm talking sundresses where it's just completely loose around the stomach, and very, very stretchy pajamas. Like the pants I'm even wearing now, let me show you guys. This waistband I'm sitting here and this waistband is the stretchiest thing. These are the only pants that I can wear outside of pajamas right now that I feel super comfortable in. So you're going to want a lot of dresses and some very stretchy, comfortable pajamas. I can link what I have. Next, you're gonna want gas and bloating pills because this is gonna help to move the gas out of your body. I use the one from Hiii, and because it's more of like a natural blend. So you can use Gas X if you want. That's what a lot of people recommend, but you know me, I'm a natural girl. You know, I like my wellness stuff. So you're gonna wanna start taking that as soon as your body feels comfortable to. I started taking them immediately the next day. You are going to want to get peppermint tea. This also helps with gas and bloating, and it also is just nice to be consistently drinking something that supports your digestive system. I had painkillers after my surgery because I was in such bad pain, and painkillers make you constipated, so you are going to want to get like a stool softener or fiber. I use fiber pills personally. I was drinking a lot of aloe vera juice, so I just stocked up on like my gut supporting things anyway. I drank a lot of bone broth post-surgery because that's what I was doing pre-surgery anyway, just for my gut health. All these things that really support your digestion and support your gut health, you are going to want to keep incorporating. Now, because they give you an antibiotic in the actual surgery, I personally didn't take an antibiotic post-surgery, but I found this really cool like 14-day reset from Seed. And so I actually bought this for post-surgery, but if you have your regular probiotics, please feel free to use that. I just found these to be really cool because it seems like it's a bit more intensive for a gut reset. As you're recovering from surgery, your gut is also going to be needing to be replenished with good gut bacteria. So this is how I would pour into myself. You are also going to want to walk lightly and gently and move your body. I'm talking about even the first day after surgery. I was just doing a light little walk around my apartment complex, just super gently on my floor, just to get that gas moving. Nothing crazy. You're gonna want your buddy with you, holding your hand, helping you, because it's just, you want to be really easy on the body, but you also want to get some of that gas moving. It does not have to be more than 4 minutes. You can just go, you know, walk to the end of somewhere and come back. And you do not want to be still for too long. That was one of the things my pelvic floor therapist really recommended, is she's like, you do not want to bed rot for 4 days. Highly don't recommend just laying in bed only. You're gonna want to just like get up, go downstairs, get your water, do whatever. It might feel uncomfortable, you might be in a lot of pain, but I just recommend doing that. Let's talk about the incisions and the scars and my recovery from that. From my surgery, we had 5 incisions. Here's a picture. They were covered in steri strips. These steri strips stay on for like 2.5 weeks. Some of mine are still on, some of them fell off. The incisions are pretty small, but I feel like mine are gonna scar because I keloid really easily. So right now I'm in the process of using some vitamin E on it. I'm only 2 weeks out, so I'm not doing anything crazy, and I'm not really trying to touch them until I feel like they're truly healed. But scarring is seeming minimal, and I'm still experiencing bloating. And I don't know if it's because I put on weight in these 2 weeks, or if my belly is still large, but I definitely still have an enlarged stomach, and that's why it's so uncomfortable for me to wear pants. So I'm gonna figure that out. And for anyone who is going through this process, it is gonna be something that you should be very gentle for. I underestimated how much time I was going to need for recovery. I really thought I was gonna be like a 3-4 dayer. I thought it was gonna be 3-4 days. I'm gonna be good. I'm gonna be walking around. I'm gonna feel confident. No, this has been the complete opposite. Everybody is different, but for me, I really feel like it has been a mental game for me. I feel like mentally I have been in the dumps, in the bottom of the bottom of the bottom. Now, I got my hair done before surgery, and that is my saving grace. So thank God, if you are a black girl, get your hair done before surgery, because you do not want to be messing with your hair. You do not want to worry about your hair. And when you wake up every morning, you're going to want to look in the mirror and be like, okay, at least I look decent. Because that's one thing. If I was looking all kinds of crazy, I might be even more depressed than I am right now. Really just try to do the little things to make yourself feel good. Because for me, I don't know what it is. I think it's taking time away from work. It's feeling like I'm incapable, feeling like I don't really recognize my body. All of these things are really messing with my mental health around it. So I'm trying to do just the littlest things to still feel good about myself. I'd done some press on nails. You know, obviously I had my hair done before surgery, so I wasn't having to worry about my hair. I was not having to do it. I haven't even washed it since I got it done, which is actually amazing because it's been over 2 weeks. It's been a mental game. So anyone who has the surgery, just know that you mentally might not be in the happiest place. And I call it the post-surgery blues. And it feels a little like depression. It does feel a little bit like depression. So if you're experiencing these feelings, this is normal because I am experiencing it too. You are not crazy. And it's also just to be something to be aware of, so that if you are feeling like you're going down in that direction, you know that I need to be doing something to try to uplift myself, and whatever it may be, you know, walking in your favorite place, calling a friend, eating your favorite dessert, whatever it might be, just be really gentle with yourself. The reason that I also really wanted to take care of my gut as I'm healing is because depression, anxiety, all of that, a lot of that, it stems from your gut health. And so my gut health was not the best going into surgery as it was because of my endometriosis and all these different things that have been throwing off my body for so long. So I am eager to get back into my gut health and start repairing and healing. Overall, I can't tell you whether or not this surgery has made an entirely huge impact on my body just yet, because it's only been 2 weeks. But the expectation is that after 3 months, you will be able to start seeing differences, whether it is in your period and then whole body health, because that is the time that it takes for your cycle to regulate. And for me, the first couple periods are going to be excruciating, more than likely. They say that sometimes it gets worse before it gets better. But I'm really hopeful that in a couple of months, this will be one of the best decisions that I've ever made in my life. My surgeon did let me know that I probably will not need to return for another surgery because of the amount of endometriosis that they found. And this is also one thing that they said, that it does not matter the amount of endometriosis. You could have a ton of endometriosis in your body and have very little pain, and you can have a teeny bit of endometriosis and have a lot of pain. So the amount of endometriosis that you have isn't necessarily correlated with the pain level that you feel. So that is also something to keep in mind. Do not be discouraged if they only find a little, and do not be discouraged if they find a lot, because it's like if they found a lot, they're able to remove it and maybe it won't return through lifestyle and other things. So just don't be discouraged through this process, and confidently go into it because you know yourself. Use your intuitive instinct, which is one of the biggest things that we have that we just forget about as human beings living in a modern society, but you know yourself more than anybody else. For me, I'm really hoping that this is life-changing because it has affected everything. It has affected my mind, my body, my soul, my relationships, my community, because I just don't have the energy to go out and do things. So I'm hoping for me that this is a pivotal turn in my life. And for anyone who has been following my content and social media, you know I am so into wellness. I also want to let you guys know that anyone who is considering the surgery is not the only answer. It is really not. Even if doctors tell you that is the only answer, make sure that you answer things for yourself first. For me, I tried for years to manage my symptoms naturally, and it worked for a little bit. I was doing the acupuncture and the healthy eat, you know, all these different things, but it was so consuming and the results weren't enough for me to restrict myself and pay the money that I was for all of these different things. So surgery for me felt like the only option, but that doesn't mean it has to be for you. Relief doesn't have to look like a surgical operation. There was a book that I read, I think it was called How I Healed My Endometriosis Naturally. I got it on Amazon, I'll put it right here. But basically in that book, this woman talks about how she manages her symptoms completely naturally without surgery. I tried this, except she did hormone therapy with the progesterone, and I haven't done that. And so maybe that is something that would have worked for me. They put me on birth control for so many years, it did not work. And I've even heard of like progesterone only birth control pills. My doctor, my gynecologist had never mentioned anything like that, had never talked to me about anything like that. And I don't even know if that's something that I would have done at the time. I don't know if, you know, who would have known, who knows? There's so many different options with trying to manage your symptoms naturally if you have never tried. Now for me, I'm the wellness guru. I've been doing this wellness for my lifetime. So I'm like, and I'm still having problems. So don't think that surgery is the end all be all, but also use experiences like this to help gauge whether or not this is something that could work for you. Also financially, it can be a strain, but again, this is dependent on your insurance, and it is dependent on what you are looking for from a surgeon and what you want from a surgeon. I hope this video was really helpful for you, because I would have loved to have watched a video like this before I went and got my surgery, because I feel like it's just kind of the back door, the what's what of getting the surgery and what to expect. But if you guys have any more questions or want me to do an updated video in a couple months, I am happy to do that. Good luck to you on your journey of healing your endometriosis or discovering that you have it and finding a solution that works for you. I'm here for you if you guys need any resources, and I will see you in the next video. Mwah.